AFMC is really known.
That this video will provide ideas
And also make sure
between the office hours. Welcome to this edition of AFMC TV. I'm Robin Ledbetter. Thank you so much for joining us. Today I have with me Mr. Mark Amox, and he is the president and CEO of Unity Health. Welcome.
Thank you. It's a pleasure to be here, Robin.
So tell me about community-based healthcare and what that means.
Well, community-based healthcare is really where healthcare meets the community, and if you think about Unity Health and Searcy and Newport and Jacksonville, where we're located, it's all about neighbors taking care of neighbors, right? And so when you think about the healthcare system and the delivery of healthcare across our country and across our state, you have various levels of care, right? You have that highest level of care, like that UAMS, for example. And then you have the lowest level of care, which is your primary care office, right? We're kind of at that in that middle, right? Where we take care of the front lines of care of our neighbors every single day. But we also provide big city care, as we call it, right at home. So you don't necessarily have to leave your community to receive care, but it's really about providing local care at home.
And so where does Unity Health fit into the healthcare landscape?
Well, that's a great question, Robin. Our footprint spans almost 100 miles from Jacksonville all the way up to Jackson County and to Newport, and then over to Cleveland County and Heber Springs. And, we think of ourselves as building healthier communities. Our mission is to improve the quality of health and well-being in the communities we serve through compassionate care. And so we look at our footprint in various different ways. So Unity Health, we have the whole spectrum of care. So everything from primary care which is your local doctor in your office taking care of your snotty noses of your kids and your vaccinations and your well child and your well adult visits, all the way through specialty care, whether that's you need a knee replacement or you have some sort of other surgical need or what have you, or cardiovascular needs, through our acute process, which is in our 3 different hospitals in Newport and Jacksonville, and then our flagship hospital there at White County Medical Center. But we also have a huge behavioral health component, one of the largest inpatient and hospital-based behavioral health programs in the state. So our goal is to provide care right there at home in our neighborhoods, in our local community, to our neighbors, so that they don't really have to leave their community to receive their care.
And it's an 8-county region.
It's an 8-county region, right.
So what does it mean to improve health and well-being of the community with compassionate care?
When we think about our communities, I talk to our associates, I talk to our community about if the only time you ever see Unity Health is when you're sick or injured in our ER or in our hospital or in our physician's office, we're probably not doing our job, right? We want to make sure that we're meeting our patients and meeting our neighbors where they are. So you'll see us at the baseball field, at the soccer field, in wellness fairs and what have you, because we want to make sure that we're providing a foundation for health and well-being in the community. And then for us, it's really more than just a job. It's a passion, it's a calling, it's a mission. And so that's where the compassion comes in. We're very much a faith-leaning organization. We're not faith-based, but we're faith-leaning. So when you come to our organization, you'll hear us pray. You'll hear us talk about our faith, whatever that faith is. We will accept anybody. But at the end of the day, we think that the compassion, the heart of what we do, really leans into and informs how we create a healthier community.
And that goes into interacting with the community and being an anchor point. What does that mean?
So when you look at smaller communities, Searcy is an example, 35,000 people or so, 80,000 people in the entire county, or Newport, even a smaller community, where our hospital in Newport's a critical access hospital. So it's the only hospital within a 30 to 40 minute driving distance. So we look at our organization and our assets as that anchor point, as that rock in the community that helps provide the baseline for health. So if I pointed you to what we would think of as a healthy community, a vibrant business community, a vibrant education system, a vibrant growing community, I will also show you a vibrant healthcare system, right? Because without healthcare, we can't create all the other things that comes along with that economic development, education, et cetera.
And how does that affect rural communities, though, since a lot of those county areas are rural?
Yeah, that's very true. It makes it much more important, right? So, typically in our footprint in our 8-county area, we're the only provider of what we call acute care services or hospital services. Typically, we're the largest provider of healthcare at all, and that's not unique to Unity Health. When you look across the state of Arkansas, in the rural communities, typically there's one provider that really provides that safety net, as we think of it. And without them being there, then that community loses in their healthcare journey. And so it's really vitally important that we support our local hospitals, we support our local healthcare organizations, whether it's Unity or any others across our state.
So tell me about maternal health care within Unity. Is that a factor? Is that something that's important within your group?
Absolutely. Maternal health care is something that we've had a conversation about in Arkansas for a long time. And, when we think of maternal morbidity and maternal mortality, it's really a nationwide problem. Our goal at Unity, whether it's wherever you are in our footprint, is to continue being a part of the solution in making progress in maternal mortality. So that's adding services, that's growing our capabilities and our breadth and depth of services so that we can provide more local health care. When you think about, once again, I'll point to our community in Newport at Unity Health Newport. If it wasn't for Dr. Jones and her clinic there in Newport, you would have to drive almost an hour to deliver your baby. So any moms out there, you think about, I'm in labor, do you really want to get in the car and drive an hour? Probably not, right? You may not even make it there. And so it's really, really important for the local people, for the local community, that we provide that level of care.
And you guys have a really thriving residency program as well. Tell me about that.
So several years ago, in 2015, we made the decision that in order to do what we just talked about, which is to grow healthier communities, that we needed to play a bigger role in developing physicians, right? And so we started one of the first community-based residency programs in the state. This year, we're so excited to say that we have 104 medical residents across our footprint. And those are in 5 different specialties: in family practice, internal medicine, emergency medicine, psychiatry, and then what we call a transition year, which is sort of that gap between where I want to be and where I just came out of residency. So what our focus is providing and training doctors that are going to go out and serve the communities across the state.
And what does it mean to be a physician in a community hospital?
Well, it's probably, to me, I'm not a physician, but when I look at our doctors and what they do, not only within the walls of our hospital and the walls of our clinics, they're a part of the fabric of our community. And so when you really unpack that, it's all about neighbors taking care of neighbors. When you go into a larger city, nothing wrong with that, but you typically don't necessarily go to church with your patients. You don't necessarily see them in the grocery store. You don't necessarily see them, when you're riding your bike down your street. In a community setting, in a small community setting especially, you're part of that community, and you're going to know your patients. You're going to know their history. You're going to know their family, and it's very much, we kind of go back to that family thinking. It's all about neighbors taking care of neighbors.
And mental and behavioral health services are also so important this time that we're in. And what kind of services for that are provided by Unity?
Well, coming out of COVID and coming out of the pandemic, we've all seen this rise in the need for mental health and behavioral health services. And we feel like it's a critical part of our role to make sure that we're leaning in and supporting every aspect of our community as we create healthier communities. And behavioral health is a really important part of that. So we have a multifaceted program that spans our entire footprint from Newport all the way to Jacksonville. It has an inpatient component for adults, for the elderly, for a geriatric population, and for adolescents. We also have an outpatient component, so we can really take care of pretty much any need from a behavioral health perspective. But once again, it's all about taking care of our community and helping them heal in whatever way that they need to heal.
And we talked a little bit about rural healthcare, but you've mentioned before that it's not simple, that it can be as complicated as urban healthcare. How does that compare?
When I talk to our doctors in our hospital, it's really no different than them practicing. Most all of them trained here in Arkansas at UAMS or did some level of training in the state. And when they come to Unity, whether it's in Searcy or Jacksonville or Newport, their initial thought is, okay, well, this will be a small community. It's going to be easier. But in reality, the patients are just as sick or sicker. When I talk to our doctors in Newport, for example, when you're the ER doc in a critical access hospital like Unity Health Newport, you're the only person. You have your nursing team, but you're the doctor. You are the one and only. And so you don't have the benefit of multiple specialties around you and multiple other doctors there to back you up. And so you really have to be on your A game. And it becomes a little bit different of a challenge for them. Now, to me, that's the beauty of being part of a system, right? So our system of care then backs you up. So if you are the doctor that's on duty in Newport, you have colleagues in Jacksonville and Searcy that they're right there for you. And one of the things I think we've done a really good job of in the state of Arkansas is developing our trauma system and developing our statewide system of care. So if we do need help from that next level of care, they're only a phone call away, or an ambulance ride or a helicopter ride away. But to the community member, to the neighbor, their wellness and their sickness and their illness is no different than whether you're in Little Rock or Memphis or wherever else. The resources available to you are just a little bit different. And so when you're that physician or that nurse on the front line, you really have to be on your A game.
So that makes Unity unique in a lot of ways too, comparative to other health systems within the state.
It does. And so when you think about us here in Searcy, Newport, and Jacksonville, it's really about bringing all of our resources to bear on our community, and making sure that we're able to deal with whatever crisis or problem arises in our communities. But that doesn't mean that we don't take care of patients that may go elsewhere. We transfer patients out. So if we can't resolve your problem, then we will lean on our partners. And those partners at UMS or St. Vincent or wherever that might be, we will absolutely lean on those partners. But our goal is to provide the highest level of care we can possibly provide locally. If we do have to get help from somewhere else, we will. But then the goal is to get you back as quickly as we can, because we want you to heal right here in our own community.
When you're doing some really amazing things, too, talking about all these different community-based initiatives and rural healthcare and how you're really branching out and creating a community. So what is the model that Unity has created that the rest of the state or healthcare providers could learn from?
Well, I think that's a really important question. A couple of years ago, we entered into a partnership with the Mayo Clinic. And I think that this is something that has been transformative to our organization. So we're the only hospital system in the state that's part of the Mayo Clinic Care Network. That's a network of about 100 hospitals across the country. Now, what does that mean for us? It means that we not only have our providers, our doctors, our nurses, our nurse practitioners here locally here in Arkansas that provide direct care to our patients in our communities, but it also means that the Mayo Clinic is literally a phone call away. Whether that's in Jacksonville or Scottsdale or Rochester, our doctors can pick up the phone and call a Mayo expert and ask them for a consult, ask them for their advice. If we have to transfer a patient out to them, we can, but also from an education perspective. So we're not just limited to the educational resources that are available to us here in Arkansas, but we have this national network that we've been able to be a part of that really continues to raise the bar in our capabilities.
All of this work sounds amazing, and what a neat time to be involved in healthcare and all that you do within the community of your county area and across the state. It
is a blessing, and it is our calling, and it is our pleasure to serve.
Well, Mark, it's been a pleasure to talk to you today. I appreciate the time, you being here. And that's it for this edition of AFMC TV. Thanks for watching, and have a great day.